So, ladies and gentlemen, now we see here a 56-year-old, very beautiful lady. For normally I would say she doesn't need any injection, but of course we know, yeah, you are smiling. It's good, yeah. When she's smiling, she looks even better. Huh? So, yeah, you don't need a treatment, but we will try our best. She wants to be 46 and not 56. I told her it's impossible, for we cannot do this, yeah. But we try to change a little bit. So what her aim is, that she wants to have a little bit, she always says, like, make me this. Yeah, not with the eyes, but make me this. So, why she says that she wants to have here a little bit more projection? Why she says that? For she has a volume loose in this lateral pre-zygomatic space. She has also a little bit of hyperpigmentation. That's why it's the impression of looking a little bit sad or tired, yeah, is a little bit more. And we always have to check the face in profile view. When we look on the profile view of the face, we can see now a little bit of flatness here. We can see that here is a loose of volume, and we see that the main projection is here. What we want to do is that we want to switch this projection to the right place. We want to give her more projection on the cheekbone and not here on the nasolabial superficial compartment. For this reason, we need to give her projection. But you see, she has also a little bit of edema under the eyes. She has also a little bit of edema under the eyes. And we have to be very careful not to produce artificial malar mounds. Yeah? So, when we give a little bit of volume in the mid-face, in the deep medial compartment, we will support this lateral part, but we also have to give a little bit here, and we have to put it a little bit more up, yeah, a small sexy vector, probably to change the roundness of the eye, yeah, to change the roundness of the eye. And when we look in this face, she could also have a little bit support on the chin, yeah, a little bit more projection on the chin, yeah. This will make the chin and the proportion a little bit better. Yes, of course, we can discuss also a little bit on the jawline, but normally I don't like to do too much in one session, yeah. So I try to show you what we can do with 1 ml, and then I will show you what we can do with 2 ml, and I think it's enough for her. I'm using the famous Redka Galadari point, which was published by Galadari and Redka in December 2017 in the Journal of the American Academy of Dermatology. We are using a single entry point at the SUV. From there, with a 25 gauge TSK cannula, I will do the whole full face treatment in the mid face, yeah? And then with also cannula and needle, I will support a little bit the chin. I'm using the volume product from Bioxis, yeah, which is Cytosial volume. And this product has 25 milligram of hyaluronic acid and is a very strong projector. Yeah, so you don't need really a lot of product to give projection. In main cases, for the first session, you need just 2 ml for the mid-face restoring. So I will show you what we can do first with 1 ml. for she does not need too much support in this deep medial compartment. I will not give as usual 0.5 ml. I will give her less into this compartment, and I will try more to concentrate on the lateral part so that she gets back the roundness of the eye, so this C shape around the eye. The reference is the lateral canthus line. Lateral canthus line in the center of the souff. How we know that we are in the center of the souff? Orbital rim, and here we can see the shadow of the zygomatic ligament. So we are in between these two ligaments, and we make just a peak of the skin. Okay? True. So, volume, we go deep, never injected. We go deep. We touch the zygomatic ligament. Vous avez du douleur?
Tout petit peu.
Tout petit peu. Mieux? Mieux. Oui. So, we perforated already the zygomatic ligament, and now we are knocking on the door of the deep medial compartment, and we need, without playing the torero, who wants to kill the bull, without playing torero, we, in a gentle way, with love, we enter the door of the deep medial compartment. So, and now we are inside. You could feel it, right? I could feel it, we could see it, and when you now press, you don't see the cannula move anymore. And now we start to inject. Ça va, madame? Ça fait mal?
Non, un tout petit pic.
Mieux?
Oui.
Ah. So.
Supportable, c'est pas...
Supportable.
Un tout petit pic.
Un tout petit pic. Oh, oh, we went out, that's why. So, now we are inside again. Ça va? Ah, ça fait mal? Pas du tout.
Non.
Un peu de pression?
Oui.
Peut-être.
Oui, une petite pression.
C'est la beauté.
Oui, ça
la beauté qui vient.
Je vais sourire, attention, hein. Je vais rire.
Oh non, 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 non.
Ne faites pas rire.
So I will stop talking, for she wants to laugh, and I told her she cannot. So 0, 3, 4. A little bit more. 0, 4. Okay. We see immediately. Sit down. Sit up. Asseyez-vous. We see immediately the change from the left side to the right side. 0.4 of a product. Yeah. So this volume has a very nice lifting capability. Look how strong it is. Here we still have the flatness. We still see the shadow here. Can we go to the other side? And now you see how homogeneous is this result now. Yeah. It's not enough, of course. Yeah, we give a little bit more support here now, and we try to give a little bit, but just a little bit, for you have a nice sexy vector. You don't need a sexy vector. So I just give a little bit of support into the lateral, into the medial souff. So we check it. Entrée.
J'ai pas mal.
Ça fait mal, hein?
Non.
Ça. C'est mieux, hein?
Un tout petit peu mal.
Ah, un petit peu. C'est la cannula, hein? Ça fait mal? Pas du tout, hein? C'est votre... comment on dit? Vous êtes un peu nerveuse.
Ah oui? Oui.
Pas du tout?
Si.
Oui, hein? c'est le, comment on dit,
Le stress,
la
voiture.
espère. She's waiting for being 46. That's it.
Ah oui, d'accord.
Ah oui, d'accord. Have you seen how the roundness of the eye is changing? Look how we could give back this curve. Yeah, look, compared to the other side, a nice curve. Yes, and she does not need a sexy vector. It's too much. If I inject here, and she will get a more projection. It's too much. Yeah, so we don't give a sexy vector. It's not necessary. The nasolabial fold changed. Look how the nasolabial is smooth. I'm not anymore injecting nasolabial fold. Look, when we turn around, yeah, when she's smiling, smile, 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 yeah. Don't smile, relax, yeah. And you see how it is falling down on this side and how it keeps and holds this side, yeah. Okay, come back. We give a little bit more in the superficial, but I will use the medium. So now we start with the other side. Redka Galadari point. Entrance, lateral canthus line into the souf. So, again. Pop. Oh, caramba. This is no, the product has no lidocaine, so during the injection she's feeling nothing. Yeah, during the injection she's feeling nothing. What she is feeling is the maneuver with the cannula. Yeah, but it is okay. So breathe deeply. Yes. We have to.
Là, je ne sens rien.
Oh, non sans rien. Now we are deep. We go to the medial compartment. We have the zygomatic ligament. Ça fait mal?
Un peu.
Un peu. Vous êtes un peu stressé. Hein?
C'est logique, non?
Have you seen the other patient?
Aïe.
Elle n'était pas. I'm not injecting, so it is not. It is not the product which hurts at the moment. It is the cannula she can feel, for she has a fibrotic soft tissue. So we give a little bit. We are inside now. We give 0.4 in the DMC and a little bit in the medial souf. 0.1, 0.2. Ça fait mal? Non, c'est la pression. Is the pressure. 2 and 4. Okay. And immediately we have the change again, and we give her a little bit of support in the medial souf as well to create a little bit the shape of this under eye. And see how she changed immediately. How she changed immediately the shape. Just a moment, a little bit of pressure. Ça va, madame?
Oui.
Oui. I think you have more stress than pain. Huh? Asseyez-vous. Ah, look. Can you see how the lift? It's lifted completely, eh? With nothing. So we used now one syringe. One syringe. Look. And it will even be better tomorrow. Yeah. This is a fabulous product. I never have seen a product with such a lifting capability. Yeah. All the years. Yes. Very nice. 1 ml. Look how beautiful. Of course, we give her a little bit support to the chin. I need also the volume. So, she has a little bit scars. We have to be careful. For if the scars are fixed, yeah, then you can get some holes here. So let's tuck. Ay, 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 ay. On the chin, so we are in the midline, and we give the volume product D. Ça va, madame? Ça va, ça va, ça va, ça va. And we give. So normally I used to give projection on the chin. I was using always almost one syringe. With this fantastic product, you don't need one syringe for a chin. It would be like a witch. Eh? So it's enough if you give just a little bit of support. So just 0, 3, 4, yeah, and you will have a nice projection. Ça va, madame? Ça fait mal, pas du tout. Oh, comme si, comme ça. Don't say this. We have to sell the product. It's without lidocaine. No, but we all know if she would really have a big pain, she would not sit like that. So, finish. Half a syringe. And now, let me see how we change the projection. Sit up, please. From the frontal view, nice. And look here. What a beautiful projection with nothing. It's half a syringe, yeah? So it's really a great projection she got on the chin. Huh? And she looks more sexy now, huh? You look more sexy? Yes. So we have 1.5 syringe used for this lady, and we try to give the 0.2 on one side, 0.25 of the rest of this syringe, so we try to make a little bit a contour. Probably I give only at the corner a bolus, yeah? So this will be very nice, I think. Tuck. Always, even there is nothing, but we do an aspiration. With a needle, you know that we have to do it. We only with a needle can do aspiration. With a cannula, you never can do aspiration. Ça va, madame?
Très bien.
Très bien.
Là, j'ai rien senti.
What?
Maintenant, ouais.
L'âge.
Non, là, j'ai rien senti.
Là, j'ai rien senti. I have to learn better my French lessons. So you go directly to the bone and to the ankle of the mandibular. You see the mandibular arch. You touch the bone. Can you see it? Where I am? We aspirate. Nothing. And we inject. Ça va, madame?
Très bien.
Très bien. Vous êtes très bonne patiente.
Voilà.
Très bonne patiente. Look how nice we got just the ankle of the mandibular. And now we press a little bit. Ça va?
Oui.
Ça va. Ça va. Okay. Just not to throw away the product. It's not really a big deal, so, but I don't like it too much. Yeah, it's just a touch up on this corner of the mandibular. Look, look, look. Sit up, please. Yeah. And so, yeah, look. Just a touch. It's not too much, but it is just a touch. How nicely she got. And look here, just a touch. Yeah? Beautiful. This is a magic product. Yeah? Magic volumizing product. We used 2 syringes for mid-face, chin, and the anchor of the mandibular. So I think for 2 syringes, this is really a great result. Yeah. So thank you very much.
Thank you.
And
Thank you.
was it very painful? Vous avez eu de douleur?
Ah oui,
trop
pain, non. Ici un peu une...
de
comme ça.
pression.
Pression.
Yeah.